Hello, John and Kyle here. You've been referred to our office at Rogue Periodontics and Laser Dentistry. So what happens next?
And some of you may be interested in visiting us without a referral after noticing some gum recession, bleeding when you brush or floss, or need a dental implant to replace a missing tooth. And we understand it can be confusing to see a periodontist for the very first time. We'd like to show you what to expect on your first visit here with us.
Our team will send you a link to fill out required paperwork and questionnaire prior to your appointment. These forms help us provide genuine and specific care to you.
When you first walk in, you'll be warmly greeted by our team. They will ensure you have submitted all the necessary forms and provide any additional documentation needed.
A team member will greet you and ask you to follow them. Prior to your visit, we will determine if additional radiographs are needed from those taken at your other dental office. Typically, x-rays at your dentist's office are in 2 dimensions, which is great for checking for cavities. Here we often take a 3-dimensional x-ray or dental CT to better evaluate and diagnose periodontal conditions.
One of our team members will review the documents you have filled out, and they will also capture some intraoral photos for the records. They will ask you some additional questions to help customize your exam with us. What is most important to us is knowing what is most important to you in regards to your oral health. This will be imperative in creating a tailored treatment plan.
Before the doctor comes into the room, the hygienist will complete a comprehensive examination that includes several parts. They will also conduct an oral cancer screening. They will also evaluate how your teeth come together, which can impact your oral health. The amount of bone destruction around your teeth or implants is measured as a pocket depth.
But what exactly are pockets? We all floss and brush and try to remove the bacteria that rests on our teeth next to our gums. This bacteria releases toxins into the gums, which can create inflammation. We can determine if the gums are inflamed by noting if there is any bleeding during normal periodontal probing. Healthy gums should not bleed when they're probed. These deep and bleeding pockets hide the bacteria from your toothbrush and from the dental hygienist's instruments. This leads to progression of this destructive disease. The recording of these pockets will be a primary focus of the examination.
We will also evaluate another sign of bone loss called gum recession. This can contribute to the loss of the more protective, attached tissue around your teeth or implants. Loss of this tissue can dramatically speed up tooth loss, especially if combined with deep pockets. Deep pockets or recession can lead to the teeth becoming loose, which is also measured during the examination.
If you were referred for just one tooth, it's still essential to examine all of your teeth in order to make the correct diagnosis. For example, if you have one tooth with a deep pocket and all the other teeth have shallow pockets, likely there's a more serious problem with that tooth in question, something like a fracture. If the other teeth have deep pockets, even if they're not as deep as the tooth in question, it may be a more generalized disease.
We will review your 3-dimensional x-ray, health history, intraoral photographs, and other information during your examination. We will then come into the room to finalize the customized treatment plan. We will also clarify what you want to accomplish with your oral health. So it's good to start thinking now about what you really want.
Just as your why matters, we believe it's important for you to know ours. We don't wake up each day simply excited about fixing teeth, replacing teeth. What truly motivates us is the ability to help people, and we do that by caring for your teeth and for your gums.
That is our why. That's our team's why, to help people through helping their oral health. If all we accomplish is helping you better understand the path you're on with your oral health, and you find that helpful, mission accomplished. We just want to help. It's that simple.
In some cases, we may need to discuss the options with your dentist before we present a specific plan to you. In this situation, we will schedule you back for another appointment to review the treatment options. We will discuss at this appointment the detailed treatment recommendation and answer any questions you have.
It's important for you to know our goal is twofold. Number 1, tell you what we have found and what options we recommend specifically for you. Number 2, you get to decide what you want to do with the information that we share with you.
And after all of that, we just can't wait to see you for your first visit. So if you have any questions before, just reach out and let us know. We can't wait to see you.